I'm Chris Thomas, I'm one of the geriatricians in Cardiff. I co-run the Parkinson's service and also look after the day hospital and the elderly care assessment service in Rookwood. I decided to become a geriatrician because it's true general medicine, looking at whole body systems rather than individual systems, which I find quite interesting. It also gives me the opportunity to subspecialise as I do in Parkinson's disease. So my work's quite varied and never lets me get bored.
Hi, I'm Govind Menon, one of the consultant geriatricians in Cardiff and Wales. I took up geriatrics because I like the challenges of dealing with multiple medical problems at the same time, and it's great fun treating older patients as well.
But I'm Joe Gray, one of the consultant geriatricians in Cardiff. I chose geriatrics because I like working with the older person, and I often found that older people thought that nothing much could be done for them because they were getting old, and nothing can be further than the truth.
Hi, my name is Dr. Ahmed. I'm a geriatrician. I work at the front door and in the community. I chose geriatrics because older people are usually the most interesting people who give excellent histories. I also find them the most appreciative of the work that we do, and them and their family, treating them can be very rewarding.
Right, I'm Sarah Davidson. I'm a final year geriatrics trainee, ST7, and I chose geriatric medicine back when I was a fourth year medical student myself. At that time in Aberdeen we were doing our medical placements, and I always knew I wanted to be a hospital physician, didn't want to be a GP, but I decided that I looked at the doctors that I wanted to be when I grew up, and I thought the geriatricians were the most knowledgeable, they had the most broad-based knowledge, and they also seemed to be very caring about their patients. They weren't writing patients off, they were giving people who were very frail a good shot and a good care on their wards. So that's why I picked geriatric medicine from the start.
Okay, so I'm Shaquille Ahmed, one of the stroke physicians in UHW. The reason I went into geriatrics as a specialty is because it's one of the specialties where you can, it deals with all the different systems for the patient as well. So you're not just stuck with one particular disease system as well. And also, I mean, the other beauty of it is that you look at the patient holistically. So, you know, you look at their physical aspect, their social aspect, spiritual and their environmental aspect. So it's that holistic sort of management is one of the things I found very appealing.
Hi, my name's Rhiann Morse. I'm a consultant based at the University Hospital in Cardiff. I work in geriatric medicine, general internal medicine. Why did I do geriatrics? I think mainly because I like all aspects of medicine, and all of these things come together in geriatric medicine. So you need to be quite good at lots of specialties, and you need to bring things together for that individual patient. I also had some very good role models when I was training, and I think that influenced me a lot. My current job is varied, and that's really enjoyable. I do acute work around the medical emergency admission unit. I look after a ward in the main hospital, and I also work with a community-based service, and I run a continence clinic. I never thought I would do continence, but it's surprisingly rewarding and very relevant to what I do. I would strongly advise geriatric medicine for any aspiring physicians, as there's a place in geriatric medicine for people with lots of different interests. I'd also strongly encourage women to come into the field.
Hello, my name is Dr. John Butler. I'm a consultant geriatrician here based at the University Hospital Wales in Cardiff, and I'm a geriatrician because I chose it almost by accident, because I wanted to be a chest physician but accidentally ended up as a registrar in geriatric medicine for a year, and my preconceptions about geriatric medicine were completely changed by that year, and I realised this was something I really enjoyed, wanted to do. It was really interesting, lots of clever colleagues, and it allowed me to work in a very, very good way in terms of joined up working or multidisciplinary working for older people. What I discovered in my career as a consultant geriatrician here in Wales is that there's huge opportunities for geriatricians in terms of how they can impact and make a difference to their lives and the quality of lives of older people. I work in the acute hospital setting, but lately I've started working more and more out in the community. So I do sessions whereby I do domiciliary assessments in people's homes. I also visit care homes. I also work very closely with primary care GP colleagues to try and get the best possible outcome for our older patients. So, in addition to that, I've got quite a big role in teaching and education of geriatricians and doctors of the future who will help look after older people across a wide range of settings. Because really, it's not just geriatricians who will be looking after older people in the future, it'll be all of us. And we all need to be very skilled in understanding what the needs of older people are, particularly with respect to physical and cognitive impairment. So I would strongly recommend a career in geriatric medicine for anyone who wishes to think about it. Part of my role is to act as the Programme Director for Geriatric Medicine across South Wales, where I help trainees specialise and develop special sub-interests in geriatric medicine. But I always think that the best time to think about being a geriatrician is as a first or second year medical student, because that's the time to open your eyes to see what do older people need. We've got an ageing population. What does our health and social care service need? They need me, i.e. you, to take up the opportunity and the real rewards that are there in looking after older people. So bear it in mind. It's a very rewarding and very challenging but fun career. Thank you.